Hello and welcome. The purpose of this video is to do several things. One is to introduce myself to you, as well as to tell you a little bit about who I am and what I believe. And then we're going to also talk about a brief history of hormones, tell you what's been going on with hormones, and tell you some of the newer things that we're doing with hormones now. In addition to that, we're going to be looking at you specifically and taking a look at your hormones and how we can get you on the road to feeling better. So I'm very excited that you're here today, and so let's get started. I'm Dr. Coyle. I am the Medical Director of Progressive Women's Health, and my practice is broken up into several different categories, but one of the main categories is something that I'm very, very passionate about, and that is hormones. I'm very passionate about helping women achieve hormonal balance, okay? The way that we do that is I simply test your hormones and find out what deficiencies that you have and then replace that with natural hormones. Now, when I say natural, what I'm talking about is bioidentical hormones. Now, bioidentical hormones are the exact same hormonal structure that are the hormones that are found in your body, as composed to hormones that are synthetic hormones, which are hormones that are a different chemical structure. Those are the ones that are typically made by pharmaceutical companies, okay? So what we do here is we test your hormones, find out what your hormones are deficient in, and then we replace that with natural hormones with an ultimate goal is to achieve hormonal balance. What's been happening in women's health over the last 35, 40 years has nothing to do with hormonal balance at all. As a matter of fact, mostly it's about loading you up on one particular hormone, estrogen, okay? Now, you may be coming to me for several different reasons. You may be a teenager, or you may be in your 20s or 30s, or you may be in your 60s and 70s. It doesn't matter. So what we're trying to do is achieve hormonal balance regardless of your age, okay? And that's why the testing comes in. We test your hormones, find out what you're deficient in, and then replace with natural hormones, okay? When we talk about hormones, we talked about what's been going on in the last 35 to 40 years. Basically, how that all got started is many years ago, doctors had come to the conclusion that women who are perimenopausal or menopausal are in need of estrogen. They must be estrogen deficient. And so we came up with a drug called Premarin, and that drug is mostly estrogen. It actually comes from horses. It's actually in the name, pregnant mare urine. And so Premarin was mostly estrogen, and women got started on estrogen therapy. Back then, it didn't matter if you had a uterus or not. And so some of you that may be coming to me today may have been told that you don't need to take progesterone if you don't have a uterus. Well, how that all got started was we started women on Premarin, and women who had a uterus ended up developing uterine cancer. We know from physiology that too much estrogen causes uterine cancer. And so it made perfect sense that giving a woman too much estrogen who has a uterus is going to cause uterine cancer. Well, when that happened, instead of taking the drug off the market, that's a perfect opportunity to make a new drug. And so we know also from physiology that progesterone helps to protect the inside line of the uterus from too much estrogen, and so we developed a drug called Provera. Now, Provera is a synthetic progesterone, or a progestin. Please note that there is a huge difference between progesterone and progestins. They are not the same thing, okay? So we developed this drug, and then, so now, even today, women who don't have a uterus get put on Premarin, and women who do have a uterus get put on a combination therapy, estrogen and a progestin, like Prempro, okay? Well, the problem is that from way back when, we've adopted the idea that women are estrogen deficient. And what we're learning now and what we know now is that that actually is not the case. Women actually are estrogen dominant. Let's go back to physiology for just a second. Normal physiology, where do you get your estrogen from? You get estrogen from your ovaries. You get estrogen from your adrenal glands, fat cells, and your diet. The two hormones that make you who you are as a woman is estrogen and progesterone. Well, where do you get progesterone from? You only get progesterone from an ovulating ovary. So it makes sense that as a woman gets into her 40s, mid-40s, what happens? You stop ovulating all the time. When you don't ovulate, you don't make any progesterone. Okay? But you're still making the estrogen. So it makes perfect sense that as you get into your 40s and getting closer to that 50 mark, you are becoming estrogen dominant, not estrogen deficient. Okay? And then when you do reach menopause, yes, you do diminish your estrogen content by about 60%. So you're still making about 40% of the estrogen that you used to make. And we know now that you actually make estrogen in your ovaries all the way up into your 80s. Okay? And so this whole idea of let's remove my ovaries at the age of 45 because I only have 5 years left to use them, we know that that's not true either. Okay? And so the ovaries will diminish their estrogen content, but you're still making about 40%. But if you're not ovulating, you're not making any progesterone at all. And so physiologically, it tells us that women are going to be estrogen dominant instead of estrogen deficient. One of the things that absolutely drives me nuts is the fact that women will go to their doctor and they'll have symptoms of estrogen dominance. They end up having a hysterectomy and taking their uterus and their ovaries out, and then they get put on estrogen. Let me give you an example of that. You personally, or you may know of somebody who had a fibroid uterus, or heavy vaginal bleeding, or endometriosis, and ended up having your uterus and ovaries taken out. And then what do the doctors do? They then put you on estrogen. If I lined up a whole bunch of doctors and I said, tell me what makes fibroids grow. Fibroids on your uterus are smooth muscle growths. If I said, tell me what makes fibroids grow, everybody would agree with me. Estrogen makes fibroids grow. If I said, well, tell me what makes endometriosis grow and what makes endometriosis worse, they would all agree with me. Estrogen makes endometriosis grow. And with heavy vaginal bleeding, unless you have, some kind of anatomic problem like a polyp or something like that, for the most part, heavy vaginal bleeding is also an estrogen-dominant problem because the estrogen makes the inside lining of the uterus grow, and then when it comes time to have your cycle, you shed this huge lining. Okay? And so these women start out having estrogen-dominant problem. They then have a hysterectomy, and then they're put on more estrogen. And since they don't have a uterus, they don't get put on any progestin or progesterone at all. How can you possibly be balanced if you're only taking one hormone? That is my big gist. How could you possibly be balanced if you're only taking one hormone? That gets me to another thing that's real important, and that is the definition of menopause. For years and years and years, menopause, women will come to me and they'll say, I must be in menopause. I'm having hot flashes, night sweats, mood swings, vaginal dryness, irritability, low libido, insomnia. Okay? I must be menopausal. No. The definition of menopause is strictly to go 12 months without a period. So if you've gone 12 months without a period, you're menopausal. If you haven't gone 12 months without a period, you're not menopausal. Perimenopause is just the time leading up to the sensation of your period. All the other stuff, the hot flashes, the night sweats, the mood swings, the depression, the anxiety, the irritability, all of that is a hormonal imbalance. And I got news for you. You can have a hormonal imbalance at any age. To give you an example of why you don't have to be, somebody who's just 50, 51 or menopausal to have a hormonal imbalance problem, the youngest patient that I have so far is a 12-year-old who came to me. She was having horrible heavy vaginal bleeding, panic attacks, anxiety, mood swings, cramping. She would stay in her house for the week during her period. She would miss a week of school during that time. And she had seen several different doctors. She was put on antidepressant drugs, anxiolytic drugs. She was given birth control pills. She was started on the Depo-Provera shot. She even had a DNC to try to improve her bleeding. None of this helped, and in fact, it actually made things worse. She came to me, tested her hormones, and found out that she had a hormonal imbalance problem. got her hormones balanced using bioidentical hormones, and within 3 months, she was perfect. No mood swings, no anxiety, no panic attacks. Her periods were better. She had no cramping. She didn't miss school. She actually, went to school and actually had a great time. And, when I first saw her, she was 12. At the time of this taping, I saw her a couple months ago. She's now 17 years old. She's doing fantastic. She's one of the top of her class and absolutely just loving life. Okay? So you don't have to be somebody who is, quote, menopausal to have a hormonal imbalance problem. Now, when we're talking about balancing hormones, we're talking about there's 3 main body system areas that we have to focus on. One is the sex hormones, like the estrogen and progesterone. The second is the adrenal glands, and then the third is the thyroid. Now, when I say sex hormones, I'm not really talking about hormones that help you have your libido or the desire for sex. Sex hormones are just simply the hormones that help you or determine your sex. So for women, it's estrogen and progesterone. For the adrenal glands are very, very important. They may actually be even more important than the sex hormones. The adrenal glands are the glands that sit above your kidneys and help you to respond to any and all stress. Not just emotional stress, but physical stress as well. So just to give you an example, if you have too much estrogen and not enough progesterone, that's a physical stressor that your adrenal glands have to respond to. Okay? The adrenal glands, think about anything a doctor would give you steroids for. If you have an asthma attack that you can't get over, they give you steroids. If you have a skin rash like poison ivy, they give you steroids. Any major illness that you're having difficulty getting over, you get steroids to help get you over it. That's what your adrenal glands do, is they make steroids to help get you over things. But unfortunately, if your adrenal glands aren't doing very well, you don't have the ability to make that cortisol to help get you over your stressor at that time. Now, in the medical literature, there are only 2 recognized adrenal disorders. Okay? On the very low end of the spectrum is Addison's disease, and on the very high end of the spectrum is Cushing's disease. And then everybody else in the middle is normal. Let's describe this in terms of a bell-shaped curve. Everything in medicine goes on a bell-shaped curve. So if you start out here, as you go up, bell-shaped curve, and then come down, and then you draw 2 lines that come down this way, you're going to have 5% of the people on the low end, which would be Addison's disease, 5% of people on the high end, which would be Cushing's disease, and then 90% of people are going to be in the middle, and those people are normal. The problem that I have with this curve is that you can't tell me that the person that's right here, still in the normal ranges, but on the bottom end of that, feels the same as the person that is at the peak. Does that make sense? Okay? The person that's right here, according to everybody else, you're normal. But do you feel as good as this person up here? No. And so what do we call it when you're this person here? We call that adrenal fatigue. Okay? Unfortunately, if you went to your regular doctor and says, hey, I think I have an adrenal problem or adrenal fatigue, they wouldn't understand what you're talking about. Okay? But that's the term that we use to describe somebody who's still in the normal ranges but are on the lower end of normal. Okay? Now, since we've determined that, adrenal fatigue is a rampant problem. The good news, though, is that the adrenal glands are fairly easy to fix. And that's something that we're going to be testing, that we've already tested you on, and we'll be talking about that today. Okay? Now, here's a kind of a silly little thing to help you remember what the adrenal glands do and how we can get into adrenal fatigue. Imagine yourself, why don't zebras get adrenal fatigue? Okay? Imagine yourself being a zebra and you are in the pasture and you're eating grass. You are functioning primarily on your parasympathetic nervous system. Your heart rate is slow, your respiratory rate is slow, your muscles are relaxed, your bowel is relaxed, your bladder is relaxed, your blood vessels are dilated. Everything is perfect. But then what happens when you see a lion? All of a sudden, you then switch into your sympathetic nervous system. your heart rate increases, your respiratory rate increases, your muscles tighten up, your blood vessels constrict, your bowel gets irritable, your bladder, you may actually lose your bladder. You are preparing to do one of two things: fight or flight. The reason zebras don't have adrenal fatigue is because they actually use that response. They take off running. They run as fast as they can. They use that increased heart rate. They use the respiratory rate. They use their tight muscles. They may lose their bowel. They may lose their bladder. But they get to a place of safety, and then they relax. The parasympathetic nervous system takes back over, and then everything's fine. What do we do, or what do you do, when you get into a situation to where you're in that fight or flight system? Do you just take off running as fast as you can? No. We internalize it, we deal with it, but over time what ends up happening is your adrenal glands just can't keep up. And that's how we get into adrenal fatigue. Okay? And so we'll be talking about the adrenal glands today, seeing if you have that problem or not, and seeing if we can get you fixed with that. Now with the thyroid gland, you may have noticed that I didn't actually test your thyroid today. Okay? And the reason for that is because the thyroid gland also needs your hormones to be balanced in order for it to be working properly. And so what I like to do is get your hormones balanced first and then test your thyroid. Perfect example, if you came to me today and your progesterone level was low and your thyroid was low, if we tested them both, I wouldn't do anything about your thyroid yet because I want to get your progesterone level fixed. We get your progesterone level fixed and then test your thyroid. If it's low, it really is low. If it's not, then you're fine. Now when it comes to thyroid, we've been talking about using bioidentical hormones to deal with the sex hormones. I also do not use any synthetic hormones to treat the thyroid. Okay, so we use all natural hormones to treat the thyroid as well. And so that is the gist. Now for the exciting part, I'm going to come in and talk to you. I'm going to get a really good history from you, and we're going to look at your hormones specifically, and then we're going to formulate a plan together to balance your hormones and get you back to feeling the way you should. Okay? So I'll be in to see you in just a second.